मेरे प्यारे फार्मेसी के साथीदारों, वेलकम टू कलर फार्मा। आज और 8th लेक्चर में हम देखने वाले हैं डिप्लोमा के लेवल के एमसीक्यूज फॉर फार्मासिस्ट एग्जाम के लिए। उसका पहले जो मेरे नए साथीदार आए हैं उसको गुजारिश है कि इस चैनल को सब्सक्राइब और कर दीजिए, बेल आइकॉन भी प्रेस कर दीजिए ताकि मेरा वीडियो आपके तक तुरंत पहुंच पाए। देखते हैं क्वेश्चन नंबर 1। Which of the following steroid is not a mineralocorticoids? Cortisol, deoxycorticosterone, spironolactone, fludrocortisone. Spironolactone is not a mineralocorticoids, but it's a drug. So the correct answer is a spironolactone. Optic neuritis is a chief adverse effect of isoniazid, pyrazinamide, rifampicin, ethambutol. So correct one is ethambutol. Optic neuritis is a side effect. Antiviral activity of zidovudin is antagonized by thymidine, proguanil, vidarabine, acyclovir. So the correct one is thymidine. Question 4. Aminoglycosides inhibit the bacterial protein synthesis by binding to DNA, RNA, peptidoglycans in the cell wall, 30S ribosomal particles. So the correct one is 30S ribosomal particle. Question 5. The action of penicillin required the presence of cell wall that contain proteoglycans, peptidoglycans, N-acetylglucosamine, N-acetylmuramic acids. The correct one is it required a peptidoglycans. Disruption of the purine and pyrimidine bases of DNA pairing occur with 5-fluorouracil, methotrexate, cyclophosphamide, cisplatin. The correct one is cyclophosphamide. All are the side effect of chloroquine except retinopathy, psychotic episode, skin rashes, hemolytic anemia. The correct one is hemolytic anemia is not a side effect of chloroquine. Most serious adverse effect of propylthiouracil is neuritis, agranulocytosis, alopecia, or nephritis. The correct one is agranulocytosis. Which of the following is glucocorticoids antagonist? Methimazole, metotan, isofen, tolbutamide. The correct one is metotan. The mechanism of action of sulfonylurea is that they decrease the degradation of glucose, lower blood glucose by producing insulin-like effect, stimulate the release of insulin from the beta cell of pancreas, or increase glucose utilization in the periphery. So the correct one is stimulate the release of insulin from the beta cells of pancreas. The correct answer is C. Anti-neoplastic agent that is classified as an alkylating agent, that is bleomycin, tamoxifen, vincristine, or busulfan. The correct one is busulfan. Antimalarial activity of chloroquine is due to inhibition of protein synthesis in plasmodia, inhibition of phosphate incorporation into the RNA and DNA of plasmodia. It paralyzes the plasmodia, inhibition of the cell wall synthesis. The correct one is inhibition of B, inhibition of phosphate incorporation into the RNA and DNA of plasmodia. The most common drug causing anaphylaxis is streptomycin, indomethacin, penicillin, paracetamol. Correct one is penicillin. Diethyl carbamazine is used in the treatment of hookworm, roundworm, filariasis, tapeworm. The correct answer is filariasis. Benzthine penicillin is ammonium salt of penicillin Z, benzyl salt of penicillin Z, dibenzyl ethylene diamine salt of benzyl penicillin, benzamide salt of penicillin. Correct one is dibenzyl ethylene diamine salt of benzyl penicillin. Which of the following is not an osmotic diuretic? Mannitol, urea, indapamide, glycerol. The correct one is indapamide. Drug of choice in motion sickness: terfenadine, pyrilamine, scopolamine, carbinoxamine. The correct one is scopolamine. Rifampicin alter the color of urine. It is a desired effect, beneficial effect, harmless effect, harmful effect. It is harmless effect. Acetylcholine is metabolized by an enzyme, catechol O-methyltransferase, choline acetyltransferase, choline esterase, monoamine oxidase. The correct one is choline esterase. Prodrug is defined as a drug which competes with another for metabolism, an inactive drug which get converted to active metabolites after biotransformations, a drug which gets converted to inactive metabolites after biotransformation, a drug which potentiates the effect of another drug. So correct one is correct one is a drug, inactive drug which gets converted to the active metabolites after biotransformation. So the correct answer is B. ये थोड़े बहुत हमारे अटेम्प्ट थे. If you like, then share, subscribe. Thank you. Thanks a lot.